In the last lecture, we talked through the diagnostic criteria for bipolar and bipolar-related disorders. In this lecture, I'll talk you through the diagnostic criteria for depressive disorders. So, if you recall, there are three particular types of depressive disorders I'd like you to be familiar with in this class: major depressive disorder, persistent depressive disorder, and premenstrual dysphoric disorder. Let's start with major depressive disorder first. The diagnostic criteria are actually really straightforward. First, the person has to have experienced a major depressive episode. Second, this episode cannot be better explained by another disorder. And third, the person has never experienced either a manic episode or a hypomanic episode. And this last point makes a lot of sense if you think back to the diagnostic criteria for bipolar I and bipolar II disorders. Because if you remember, any instances of manic episodes automatically categorize the symptoms as reflective of bipolar I disorder, and bipolar II disorder is when there are both depressive episodes and hypomanic episodes. Similar to bipolar I and bipolar II disorders, there are also a number of specifiers for major depressive disorder, including if this is the first depressive episode the person has experienced or if the person has experienced recurrent episodes, the severity of the symptoms, whether or not they've been in remission, and whether psychotic features are present, and any number of other specifiers to further describe the client's experience of major depressive disorder. The next type of depressive disorder I'd like you to be familiar with is persistent depressive disorder. And you can think of persistent depressive disorder as essentially a persistent or chronic depressed mood. So depressed mood and associated symptoms that last longer than the 2 weeks that are required to meet criteria for a depressive episode. So more specifically, in order for someone to meet criteria for PDD, they have to experience depressed mood for at least 2 years. And during that time, they also have to experience at least 2 symptoms that could include poor appetite or overeating, insomnia or hypersomnia, low energy or fatigue, low self-esteem, poor concentration or difficulty making decisions, and feelings of hopelessness. Furthermore, the diagnostic criteria stipulate that the person can't have been without the depressed mood and the symptoms, which we call criteria A and B, for more than 3 months at a time, so the symptoms really do have to be persistent. Now, it is possible for someone to also meet criteria for major depressive disorder during that same 2-year time period, so it's possible that the person's depressive episode has lasted continuously, but that's not necessary. Next, the person has never had a hypomanic or manic episode, and they haven't met criteria for cyclothymic disorder. The symptoms are neither better explained by another disorder, nor caused by some other known factors such as a medical condition or substances. And finally, the symptoms must cause clinically significant distress or impairment. The last disorder I want you to be familiar with is premenstrual dysphoric disorder, or PMDD. And I wanted to include this one because although it's not the only sex-specific psychiatric diagnosis included in the DSM, it is actually one of the few and the only one that we're going to be talking about in this class. Now, PMDD has been long debated, but it first showed up in 1993 in the DSM-4R as a research category. It's still pretty widely debated, as some claim that it stigmatizes a sex-specific biological experience, but it's now included as a diagnosis that's thought to affect between 1.8 and 5.8% of women. Now, I should say that when I'm describing PMDD, I'm going to use all feminine pronouns, but this is something that can affect women regardless of their gender identity, so just keep that in mind. So first, in order to receive a diagnosis of PMDD, the person must have at least 5 symptoms that are present in the week before a woman's period begins, start to improve within a few days after her period starts, and become minimal or absent in the week after the period ends. And this has to happen in the majority of menstrual cycles. The types of symptoms that the person must have in order to meet diagnostic criteria have to fall into groupings. Symptoms that are more related to mood, and symptoms that are more related to behavior or attitude. So the person has to experience at least one mood symptom, including things like marked affective lability, which basically means mood swings, marked irritability or anger or increased interpersonal conflicts, marked depressed mood, feelings of hopelessness or self-deprecating thoughts, marked anxiety, tension, and or feelings of being keyed up or on edge. And at the same time, the person also has to experience at least one symptom related to what I call behavior or attitude. Things that fall into this grouping of symptoms are decreased interest in usual activities, subjective difficulty in concentrating, lethargy, being easily fatigued or having a marked lack of energy, distinct changes in appetite, overeating or specific food cravings, hypersomnia or insomnia, a sense of being overwhelmed or out of control, and physical symptoms like breast tenderness and swelling, joint or muscle pain, bloating, or weight gain. And so it doesn't matter how many symptoms come from each group, as long as there's at least one mood symptom and one behavioral or attitudinal symptom, and there are 5 symptoms total. Lastly, the symptoms have to cause distress or impairment, and the symptoms can't simply be an exacerbation or exaggeration of symptoms of another disorder. So those are your mood disorders. Feel free to review these videos as many times as you'd like. Remember that there's not a quiz for Monday, so you can have some time to get ready for the first media grab. But we'll talk some more about this in class. All right, see you then.